When disaster strikes, it's difficult to predict in what circumstance you may find yourself. Often there is chaos and confusion all around. Roads may be shut down, communication systems may not function, and if you, a neighbor, or someone you love needs serious medical attention, very few people in the world have what's necessary to treat injury immediately and potentially save a life. If you found yourself in this position, most first aid kits found in the home or office would be insufficient. In a lot of cases, you may find only a few small plastic bandages and some gauze, which could be too little too late. To be fully prepared and to take action, you need a comprehensive EMS-style trauma kit that provides many of the essential tools and resources that trained professionals utilize in emergencies. Our EMS trauma kit provides detailed instruction for use on all components and will empower you to be the one who provides help when it's needed most.
Hi, I'm Michael, and I want to take a few minutes and provide some information on the featured components of our EMS trauma bag. This kit contains more superior components than any other trauma kit on the market. When a medical emergency happens, you'll be able to take action and even save a life. One of the most common injuries that put families into the emergency room are cuts that require stitches. Wound seal is an essential item for stopping bleeding and in a lot of cases removes the need for stitches. So this is our wound seal with applicators. Our wound seal with applicators is meant for nosebleeds and head wounds. How it works is you just take out the package here. There's a little applicator. Open this applicator up, dip it into the powder, and hold it on the wound. Especially if it's like above the eye, you just hold it above the eye over the wound. Or if it's a nosebleed, you just take it up the nose, hold with pressure for about 30 seconds, and it should stop a nosebleed like that. Our rapid response wound seal vial that's in your kit actually is meant for bigger wounds. You can use this product on a wound even 3 to 4 inches long. Just pour it over the wound, hold with pressure. Once you release that pressure, if the blood starts bubbling through, you just put a little bit more on, cover it with pressure again until it stops. Once the wound seal has been applied, it's waterproof within about 2 to 3 hours and can just be left on the wound. It contains a hydrophilic polymer that bonds with the blood and forms a scab. It also contains potassium ferrate, which is an antiseptic, so you don't have to worry about cleaning the wound. I still recommend if there's debris in the wound before you apply it, maybe wash it out with sterile water, but after that point, let it bleed again. It only reacts with blood. Pour it on the wound, hold with pressure, and you'll be good to go. Wound seal is non-toxic, can be used on pets, can be used on children. It can be used on hemophiliacs or people on blood thinners. Wound seal covers, protects, and disinfects the wounds. Our Steri-Strip product is a superior product to any type of butterfly bandage. When you have a wound that's open and dry, but you need to close it up, that's where this product comes into play. You just open this up. It's an adhesive. You apply to one side of the wound, pull it closed, and then apply it to the other side of the wound. It will hold the wound closed and let it heal. Our Blood Stopper compress that comes in your bag is a 2-in-1 product. Instead of having a compress and a gauze to use separately, it does it all in one. So to use the Blood Stopper compress, just apply pressure and then take the gauze roll, and as you go around the arm, you can actually twist the gauze roll to apply direct pressure to the wound site. Once that's done, just tuck the gauze in. Your bleeding is controlled. An essential item in your kit is our QuikClot product. With an arterial bleed, it's essential to stop bleeding, and using gauze or compress doesn't always do the job. Using the QuikClot product is essential at saving someone's life in that type of situation. Even with a femoral artery, which can bleed out in as little as 90 seconds, you can pack this product into the wound, completely stop the bleeding, and buy someone up to 24 hours of time. So opening the QuikClot, you're going to find a mesh bag inside. You don't open up that mesh bag. You actually take this whole bag and stuff it in the place of a wound. Pack it into the wound and hold with pressure for about 5 minutes. Once that 5 minutes has passed, then you can secure it with a gauze roll or an adhesive bandage and leave it there until you can get medical help. In the case of an arterial bleed, you're going to need medical help to repair that damaged artery. There's nothing better at treating burns than our Cool Blaze and Burnout products. You hear a lot of people that use water. Water on a burn, first of all, it dissipates too quickly. It doesn't have the capacity to pull out heat. It's also not sterile. You can introduce infection to a burn. Our burnout product is actually 96% water, but it's in a gel format. That gel, when applied in a thick layer, can pull out the heat very quickly. It can be used on pets, children. It's non-toxic, can be used on the face, the eyes. Any type of burn you can use this product on. We have our burn face dressing, which is a large dressing to be used over the face. It has holes cut out for eyes and nose and mouth, or it can be used over a large area of the body. Most burn products that are on the market are petroleum-based. They're just meant to give you pain relief. They don't draw the heat out of a burn. Our product is actually meant to draw the heat out of a burn area, and a lot of times minimize the damage that's caused by a burn. In a lot of cases, whether it's what would be a second or third degree burn, we can bring that level of damage down. So for a child's face who's been burnt, this product is essential to have in the home. Put it in a thick layer. The thicker the layer, the better, and then leave it. Typically after about 45-50 minutes, the product will dissipate. If there's still pain and sensitivity in that area, just reapply and let it do its job again. The secret to using our Cool Blaze product is you don't want to rub it in. If you rub it in, you'll get pain relief, but you won't draw the heat out of a burn. None of our products contain lidocaine. Lidocaine can cause pain and is also toxic to the skin. So I'm applying the Cool Blaze product here in a thick layer. As I said, the thicker the layer, the more capacity this has to draw the heat out of a burn. What I'm going to demonstrate here is the capacity of our Cool Blaze product to pull heat out. I wouldn't recommend trying this at home. It's just to demonstrate how well our product works. 1600 degree torch. Now if I was to put water on my arm, how long do you think I could do this for? Seconds. But with this product, you can see how fast it's pulling the heat out. I can't feel anything but a little bit of warmth. Our Rapid Relief ice packs are the only ice packs on the market that can be applied directly to the skin. Because they use a soft fibrous coating, you don't have to put a barrier between the skin and this ice pack. Our ice packs aren't just for sprains and strains and bruises and bumps, but in the situation of a heat stroke or heat exhaustion, this product can actually save a life by bringing down the body temperature of a victim. Another one of the unique products you'll find in your kit is our Rapid Cool product. This is the best product there is for a strain or sprain injury. In case of a more severe injury that may require surgery, this product reduces inflammation and allows that surgery to happen faster so that you can recover quicker. A Rapid Cool is an 80-inch wrap that can be applied directly to the skin as long as there's not a break or cut in the skin. But for a sprain or strain, this is the best product there is for stopping swelling, inflammation, and cooling the area. The way you want to use our wrap is wrap with some compression, always wrap towards the heart, overlapping about half the wrap every time you go around. Once you've covered the area, just cut off. And you can either tuck the wrap or use our clip. With a sprain or strain, when you use ice, you can only leave the ice on the skin for about 20 minutes, after which point you need to take it off, let the extremity warm back up for about 20 minutes, and then put it back on. Problem with this is you're not getting treatment during that time. Using our Rapid Cool, you get 360 degrees of coverage, you get compression, cooling, and then also the arnica, which is in our product, will stop inflammation immediately and even pull out bruising, shortening the healing time with any sprain or strain. In the case of a broken bone, our Stat Splint is the best product there is for providing comfort and splinting in that situation. The benefit of using the Stat Splint is that it's moldable, so you can easily conform to the site of the injury. So just like he's doing here, you can conform that Stat Splint around the bone, and then by using a Coflex bandage, you can secure it in place. Now the arm is immobilized and no further damage can happen. Another great tool in your kit that can save you money is our fracture fork. This tool can be used to detect a broken bone in your own home. If you have a victim who comes in complaining about pain, let's say in their arm, well, first you want to take a baseline test. So what I want to do is test the arm that's not hurt first, let them know what this is supposed to feel like. So what I do here is I wring the fork, apply it to the bone, and let him feel it. He's going to feel a vibration up that bone. Then I go to the other arm that's hurt. If it's just a bruise, he's not going to feel any more pain by applying this to the bone. But if he has a fracture or break, he's going to pull away. And he'll actually feel pain right at the site. Outside of a skull fracture, this tool can be used to detect any broken bone in the body. The stethoscope is another unique item provided in our EMS kit that can be used in conjunction with a fracture fork for detecting broken bones or to identify breathing problems. Assisted breathing is still an important part of CPR, despite what you may have heard. That's why we provide a CPR mask. In the case of vomiting or the transfer of disease, you can use this as a barrier between you and the victim. Another unique item you're going to find in your EMS kit that you will not find anywhere else is our foreign object removal kit. The only other place you'll find this kit is maybe in a physician's office. The 3 retractable stainless steel tools in our foreign object removal kit are: first, our splinter probe. Splinter probe, as you see, has 3 flat sides with a pointy edge. Unlike a needle or a pocket knife, when you're trying to remove a splinter, this easily gets under the skin to get underneath that splinter and then either remove it simply or hold it there while you take our tweezers, which come to a point, and remove it safely. The other tool is our eye magnet loop. So our nylon loop, which can be used to sweep debris out of the eye. The other side is a magnet, so if you have something metallic in the eye, you can run this across the eye and draw metal objects onto the tool. Included in your EMS trauma bag is our treatment guide, which provides specific ways in which to use the products included in that kit. From minor injuries to major heart attack or heat stroke, this guide will empower you to know what to do in an emergency situation.
Whether it's an injury caused by disaster or simply a way to avoid a trip to the emergency room, our EMS trauma kit will be there as your most essential and dependable first aid supply.